New COVID boosters starting to make their way into pharmacies across the tri-state area.
That's right. This new shot designed to battle Omicron and its variants ahead of a potential fall and winter surge. So joining us this morning is New York City Health Commissioner Dr. Ashwin Vasan. Good morning to you, Commissioner. Thank you for being here this morning.
Thanks for having me.
So, Commissioner, let's get right to this and right off the bat. When can people start getting these new shots? What's the timeline?
Right away. And so we're incredibly excited that these boosters are here, that they're safe, and that they're finally covering the Omicron variant and its subvariants. You know, one of the biggest critiques of the vaccines over time is that people are reporting getting infected while being fully vaccinated. Yeah. And part of that is because of Omicron's mutations and its ability to evade vaccines. It still protects significantly against severe illness and death, but now we're really excited because these new bivalent boosters have the potential, if they're widely adopted, to also reduce transmission even further.
So when you say right away, what does that mean? Meaning today we can go get them, and where?
Yeah, call your primary care provider. You can go to vaccinefinder.nyc.gov and look for appointments. They're also available at chain pharmacies like CVS and Walgreens and Duane Reade. And so yes, they're widely available.
But are they being widely used? Even their predecessors, do we see that enough people are complying with this? And what's it mean as we go into the fall and the winter and we're going to be inside and our kids are going to be back in the classroom close to each other again?
Yeah, absolutely. And this is why now is a perfect time to go get that booster, to get your flu shot as well. We're entering into flu season as well. Back to school time is always an important time for families. My kids are going back to school tomorrow. And, you know, we're getting ready. We're getting up to date on all of our shots. And so, you know, now is a perfect time to go get your COVID booster. We don't know what the fall will hold. We don't know what the winter will hold. But the best way to be ready for whatever it throws at us is to increase and re-update your protection. If you're 12 or older and you're more than 2 months out from your last dose, now is the time to get boosted, especially if you're in a high-risk group. If you're over 65, if you're unvaccinated or undervaccinated, or if you've got a chronic health condition like diabetes, high blood pressure, heart failure, cancer, these are the populations we also extremely want to get vaccinated right away.
Yeah, so the vaccination obviously is so key to staying safe and healthy yourself, right? And you can really kind of bundle it with your flu shot every single year now, it seems like. But there's also some restrictions that are still in place, right? We see the mask mandates, for example, still on the subways, Commissioner. The governor has teased an end to mask mandates in public transportation. What can you tell us about this? Is it happening this week?
Look, I mean, I think we all acknowledge that we're at a different point in the pandemic today than we've been at any other point. Transmission is going in the right direction. We're at our lowest rates of transmission since April, and we're seeing over the last several months a real break between cases and hospitalizations and deaths. We're seeing extremely low rates of severe illness and death. All of that is extremely encouraging, and we're looking at all of our policies around that as a result. And so whether it's masks or vaccines, I mean, I think we're looking at all of our policies right now, and I'm sure the governor will have more to say on her policies as well.
One of those big policies that so many families are focused on right now is tomorrow's the start of the school year here in New York City. Classes have already started across the tri-state in many areas. There aren't many COVID restrictions in place, no masks, no testing at school, no more daily health screening, but yet numbers show nearly half of students have not been fully vaccinated. Is this the right time, especially now that we all go inside and we're close together again?
It's a perfect time, and we're re-upping all of our all of our immunization messaging for back to school. Students need to be up to date on all of their vaccines, COVID, polio, as well as a range of other things in order to go to school. And so we're re-upping that messaging right now. It's a perfect time to go get your students vaccinated now. We definitely have seen lower rates of vaccination in school-age children, but I think the constant messaging needs to be these vaccines work, these vaccines are effective, they prevent against severe illness, and now is a perfect time to do it as we do get back into classrooms so that schools remain the safest place in our city.
And so I'm hearing what you're saying. So what if they're not? What if they're not fully vaccinated? And with this new booster, right, that now is seemingly going to be every single year, what if they're not up to date? Who is monitoring that? And are they to stay home if they are not?
Well, I think we're still learning a lot about how long immunity will last. So I know some folks are saying it's an annual thing. I'm not sure if whether it's annual or for certain groups it's going to be more, but for kids, I mean, I think there's no more important time to get boosted than now. Right now, we don't have restrictions in place, but we do have a pretty aggressive testing regime planned for students. You know, every student is going to get delivered at-home tests on a monthly basis, and if they are exposed to a child who tests positive, they're going to get sent home with two test kits. So, you know, I mean, I think we're still taking steps to keep schools open.
Right, but just to be clear,
but we're not asking students to stay home or to make restrictions at this stage because we're at a different point in the pandemic.
Right. So so tomorrow you don't know exactly who is vaccinated, who's not in terms of COVID.
We haven't checked vaccination status for students in terms of their eligibility to go to school, because we know that the decision to get vaccinated by parents is a challenging one. It requires trust, it requires communication, and it sometimes requires time. We're also waiting for all of these all these vaccine products to become fully licensed by the FDA and by the state. And over time, that'll help build confidence with parents and pediatricians to make sure more and more and more kids
And
get
just
their
very
COVID.
quickly before we let you go, just a few seconds remaining. What is the schools and what is the city health department doing about monkeypox when it comes to the school population?
We don't believe monkeypox is a significant source of spread in schools. We don't think schools are a significant place of risk for monkeypox spread. And we are also seeing cases significantly drop due largely to behavior modification in the most at-risk group and our pretty significant vaccination campaign efforts, where we've vaccinated nearly 80,000 New Yorkers in a span of about 2 months. So I think we're moving in the right direction.
Very good. Important information all around here. Good luck tomorrow with the first day back to school and safety for all of the students, including your own kids. Commissioner Vasan, thank you so much for being here.
Thanks for having me.